Hi, Gert.
Hi.
It's a pleasure to be with you here. And I think our mission is to tell people about just a little bit about the history of Buurtzorg and our partnership and how we are going. So, first of all, I ask you please to tell why Buurtzorg was organized in the Netherlands and what your participation in this and what are the principles and the things that you think it's most important for us to know about Buurtzorg?
Yeah, thank you so much, Marta. It's such it's really an honor to be here with you finally in Brazil. It took some years to be here, but it's great to be here. So I'm Gertje Von Roessel. I'm a nurse living in the Netherlands, and I started my career, professional career, in the 80s, working in a small community as a community health nurse, providing service to patients in small community. And that was the reality in those years for all the nurses providing home health care in the Netherlands. There's a long history, tradition of providing home health care in the Netherlands. That's very common. And we were very happy being able to deliver this. But then during the 90s in the Netherlands, we got a lot of changes in the healthcare system. So more and more bureaucracy came in, all kind of regulations, administration, and we as nurses were confronted with more and more administrational work. We were pulled out of the primary process and needed to spend more and more time in the office. And we were frustrated because we said that's not why we started to become a nurse. So that was also my reality during the 80s and the 90s. And then in 2006, Jos de Blok, he's the founder and still the CEO of Buurtzorg, our company. He invited me for a drink in Amsterdam. And he told me about his idea of setting up a new home healthcare company in the Netherlands. And he told me about the principles that he wanted to introduce in this new company. And most of all, what really impressed me was the simplicity of his story and his idea. And I told him, well, it sounds beautiful, because for me it resonated what I experienced during the 80s, working in a small team. At the same time, I thought, well, this can't be true. It's too simple. It's never going to work in this complex healthcare system in the Netherlands. But I said, okay, I'm going to give it a try. Why not? Because it can't get worse. I was so frustrated in those years. So I quit my job and started from the beginning with Buurtzorg, a company that we started from scratch on. So there were a lot of big home healthcare organizations at that time in the Netherlands, and we started completely new, really from scratch on, with good ideas and with really motivated people, colleagues. And we said we're going to work with very simple 6 principles. And I can introduce the principles. First of all, we would provide holistic care, not only looking at one task when we would be with a patient, but having a generalistic view and looking at the whole person. Second principle that we said is very important is first we would drink coffee and then we would provide care. And having this cup of coffee is not because we love coffee, like you do here in Brazil. We have lovely coffee here. But it's because we think that by having this moment of sitting down with our patients and sometimes with the family, we are able to build up, step by step, a trustful relationship, which allows us to really explore the needs of this person. So that's the second principle. Then the third principle is that we said we will make sure that the teams that will be working in local neighborhoods will be able to find local solutions that will fit to the local needs of the people living in that specific area. Because you can imagine, like, we're now here in Rio, that a team working here in Rio with people living here in Rio, that they are facing different problems, different issues, a different neighborhood, different context. So solutions that they will need to find will be different than in another another city or another neighborhood. So we said we will make sure that the teams will have that possibility. Find local solutions, and we will not bother them with overall rules and protocols. Fourth principle is that we said, as much as possible, everything related to the primary process for the nurses will be organized within a team of nurses, because that's logic for them. And as long as it's not logic anymore, we will take it away and we will do the administrational processes in a back office. So there's a clear cut there between daily practice processes there and administrational processes. Then we said, as a fifth principle, we will develop our own software. There was a lot of existing software in the Netherlands in those years, but it was never serving the frontline care professionals. There was always a hinder. So we said, no, step by step, we will develop our own software. And the last principle is that we said, if we really want those teams to be able to provide high quality of care, to improve the life of the people living in that area, the team needs to be able to connect with the local neighborhood. So the size of the neighborhood we defined should not be too big. Otherwise, they will not really be able to build up this network. So that's how we started.
Great, great. And for who doesn't know, Gertje was the first person that I met in Netherlands when I was there to know the system of the Netherlands health system. And in this first time, there was 2018, I was shocked by how Buurtzorg could change all the system, the health system in Netherlands. So everybody in the system recognized the paper that Buurtzorg brings to this health system and how you could change the way of dealing with chronic persons and persons who necessitate something different in their homes. So when I was there, I was shocked by this, and I said, I need to bring this to Brazil. And more or less 3 years ago, 3 years after this, I phoned you and said, Gertje, I need to bring this to Brazil. And what do you think in this moment? What do you think about bringing this model to Brazil, a place so different, so big, with so many cities and so many things that could be so different from Netherlands? What do you think there?
Yeah, I think that's the beauty of what we experience, that people come over and visit Buurtzorg because they want to be inspired or they just want to hear the story. Likewise with your visits, at that moment, of course, we couldn't realize we would be here right now, sitting in the center of Rio, talking to each other. But what we do, and it's more or less like we plant little seeds. And we don't know what will happen with these seeds. People fly away again, go home, and like you went back home to Rio, to Brazil. And then we don't know what will happen because, and this is also in our international work for Buurtzorg, we are very well aware that we need local people in other countries who get inspired, who have a vision, an idea, and who have the courage to get things started. And because we realize we will never be able to do this ourselves. We need local people who know the local context, who speak the language, who understand the culture, who know the rules, the unwritten rules, how it works in a specific country. And that's why we were so happy that, and it was in the beginning of COVID, I think, that you reached out again and said, and told us what you had been doing during those years, thinking through and working out and wanted to start this Laços.
And what impressed me most was this holistic approach, because here in Brazil we forgot to do for a long period this holistic approach. So here we have a very not organized approach in health, and because of this, people is suffering the effect of this system. So I think it's worse than it was in Netherlands before. So after 2 years, we have some results that I showed you these days, and we can discuss here. That is very important for us and for the system. And after you come here and see us and see what we have done in these 2 years, what do you think about it, and what you can tell us to do or not to do?
Well, that's always the challenge, of course, because we've learned in our international work, you can't just copy Buurtzorg and what we do in the Netherlands and then take it away in your luggage and paste it here in the Brazilian context. That's the big challenge, I think, for our international partners and for you, to make it happen here. And don't forget, even for us in the Netherlands, it sounds for you simple to say, well, you changed the healthcare system in the Netherlands.
It was very difficult.
But it took time, it took effort, and it took an ongoing energy, and we're working on it even nowadays, every day, to make this happen and to continue this change. So even for the Netherlands, it wasn't easy. And it's great for me. I've only just arrived, so it's an early stage. But what I hear and sense and feel is that because I was able to join your team yesterday, and with some visits with our patients, and it's beautiful to see that even it's very far away from the Netherlands, but once I'm there with your nurse and with the patient, it feels like this is what I recognize. And this is, I think, what we should try to bring to our patients. So even if your system, and I do realize and I respect, because I think it will be quite challenging here. But I think if you will be able to take as the starting point the patients and the needs of the patients and what is needed there to organize it, to make sure that not only your patients but also your nurses will be supported and empowered to deliver this good quality of care, I think then...
Great.
We will be there.
Good to hear. But at the first meetings that we have, a long time ago, 3 years ago, Jos, for who doesn't know, Jos de Blok is the CEO and the founder of Buurtzorg. He has strongly believings on what he thinks, and he goes straight forward what he believes. And one day he looked at me and said that he wanted to see on me if I had proposed. And this makes me feel very anxious and thinking, do I have capacity to do this? Do I have this power to bring something so different and so strong to here? And now I feel that I could do this because it was very difficult, very difficult. But when I look at the results today and I look behind, I feel that we can do this.
Yeah.
But one of the things that we feel that it's very difficult for us, and I think it's for you too, is the feeling of responsibility. We have already discussed this, and I think it's important for us to discuss this. How is the feeling of responsibility when you, a nurse, is with a patient or a client in his house, and you feel the responsibility and the loneliness to be there? We discussed it a little bit, and I think it's important to discuss with all the persons.
Yeah. Yeah, I think working in the community, in home healthcare as a community nurse, is a complete different profession than working in a hospital. It's a very lonely job, and therefore I think it's so important that you are working in a team, so that even if you enter the house of your patient where you will be on your own, you feel that you are supported by the team that's also working in somewhere else. And at the same time, it's the beauty also of our work, because I think that it's so precious that we are able to, that people, the patients, allow us to enter their houses, and that we can see where they are living, and we can look at the pictures in the house, and we can smell, and we can feel and hear and sense, which gives us the possibility to have this holistic approach, which is different than in a hospital, where a person immediately becomes a patient, stepping into the bed and sort of, I'm dependent on you. And so, yes, I think it's an enormous responsibility, but that's also, I think, why we choose this job of becoming, or this profession of becoming a nurse. And I think the responsibility for you and your colleagues in the back office is to fully support and protect the nurses. Because that's also what I saw during the years of our CEO, Jos de Blok, that his role was not only trusting us, the nurses, but also protecting us, because we were doing something special in the Netherlands. And I think that's also what you are doing here in Brazil. You're doing something special, different. And the external world might look at you, and some will say beautiful, and other might feel threatened, not happy. And I think, and that's your responsibility, Marta, that you also need to protect your nurses, your staff, to allow them to explore and to experiment and to learn by doing, what they need to do. And in the Netherlands, we at Buurtzorg, we are convinced that this role is there for you. We have no doubts there. But I do realize, and we fully respect that it feels like a lot of responsibility. But if you talk about power and motivation and vision and having the trust in your staff, we know that you have it, and I saw it yesterday as well. It's
great,
no doubts there.
And in the day by day, we don't recognize the powerful there is to be into one house. All the things that we can notice and we can pay attention and we can smell and see is totally different from you being in a clinic in one room, totally white. So it's so powerful and so different. And many other countries and other cultures are now paying attention to this too, that with technology and with our day by day so different, most of the care that we can do for these persons will be at the house. And maybe this way of being can be bring to the capacitation too, because this is the second point that I think it's most important, how to capacitate professionals to do this and to know what it is. And how do you think it changed in Netherlands after Buurtzorg, the capacitation and all the professionals looking at it and trying to understand what it is?
Yeah, yeah. Yes, and again, working in home health care, in community is different. So you need to train different, and you need to provide extra support and training, and in the education for nurses in the Netherlands, this is integrated. So if we in the Netherlands, when we become a nurse, integrated in our study is already community home health care.
Great.
And I understood from you that this is not part of...
No, very far from this.
Okay. So, and I think that's very important to provide this training, support to the care professionals here who work in home health care. How to look at the community, how to build up a network, which is important, how to have this holistic approach. So all kind of perspectives that you can bring in to improve the quality of care that they will be delivering. And it will not be just one-day study. I think that's an ongoing education, ongoing learning into your company.
Great. Gertje, I think we are already at the end of our timing. You know that I love to be with you and to discuss and learn with you a lot. I want to know if you want to bring a message for people who are listening to us, and tell them just a little bit more, something that you think is important.
Yeah. Well, what I definitely would like to say, because now I'm here on my own from Buurtzorg,
yes,
flying
finally.
all over the ocean, and but I hope that you and your nurses and your staff do realize that there are 10,000 nurses in the Netherlands who are working there and who are aware of there is Laços in Brazil, and that they are very proud, and that they are longing to hear my stories of what's happening here. And so I think we're in it all together. And I hope that, and of course there will be tough moments, and that you or your nurse think, how are we going to deal with this? Or that you're lacking some energy. And then I hope that you realize that there is this big group of nurses in the Netherlands that's there to support you, and that even if it's far away, we're nearby. So we wish you all the best.
Oh, thank you. Thank you a lot. It's far, but it's close.
Yes.
We feel very close to you.
Yeah.
Always. Thank you.
Thank you.